Hey everyone, welcome back to the Blueprint Nursing YouTube channel. My name is Nicole, and today we're diving into the sensitive topic of elder mistreatment, in which we will include discussions of abuse and neglect. This is a topic every nursing student and nurse should understand thoroughly. Let's get started. Elder mistreatment refers to the abuse or neglect of an older adult, defined as the intentional acts or failures to act that cause harm or risk. This can occur in many settings, such as in an individual's home, long-term care facilities, or assisted living facilities. Let's discuss the types of mistreatment to help identify and prevent it. Elder mistreatment can be split into the following categories: physical abuse, psychosocial emotional abuse, financial abuse, sexual abuse, and neglect. Physical abuse happens when a caregiver intentionally causes illness, pain, or injury to an older adult, such as hitting, kicking, or pushing. Signs of physical abuse include bruises, fractures, burns, or other unexplained injuries. Psychosocial emotional abuse involves causing emotional pain or distress through verbal and nonverbal acts. Examples include threats, humiliation, or isolation, both geographically or interpersonally. Signs that an individual is being psychosocially or emotionally abused include appearing withdrawn, anxious, depressed, and sudden behavioral changes. Financial abuse occurs when a caregiver illegally takes, misuses, or conceals an older adult's money, assets, or property for the benefit of someone else other than them. Signs of financial abuse include changes in financial habits, missing belongings, or unexplained withdrawals from accounts. Sexual abuse is any non-consensual act or contact of any kind with an older adult, coercing them to witness sexual acts or sexual harassment. Signs of sexual abuse include bruising around the genital area, sudden changes in behavior, and unexplained sexually transmitted infections. Neglect of an older adult is the refusal or failure by the caregiver to provide basic needs, like food, water, or shelter, leading to harm or distress. Signs of neglect include dehydration, poor nutritional status, poor hygiene, and untreated medical issues. Understanding risk factors help identify vulnerable clients and provide crucial assistance. Clients at high risk of mistreatment are often socially or geographically isolated, have limited support systems, so small family or family that lives far away, have cognitive conditions like dementia, or physical disabilities like amputation or Parkinson's disease. Caregivers lacking knowledge, overwhelmed by responsibilities, or facing their own stressors are more likely to neglect their duties. Elder mistreatment is complex, often involving family members who may feel shame or fear reporting the situation. Older adults may fear further retribution or be cognitively unable to report abuse. As a nurse, we want to provide safe, unbiased care and know our responsibilities in cases of mistreatment. As nurses, we are mandated reporters if we suspect elder mistreatment because older adults are a vulnerable population. Conducting thorough assessments and interviews and recognizing red flags are crucial parts of helping clients experiencing elder mistreatment. Mandatory reporting laws differ from state to state, but nurses will generally report elder mistreatment to their supervisor, who then contacts Adult Protective Services or a similar agency. Our duty is to advocate for our clients and ensure they receive dignified and respectful care. Intervention and prevention of elder mistreatment are important factors in keeping our clients safe. Here are some strategies we can remember. Education and training. We'll want to provide training to caregivers on how to recognize and prevent mistreatment. Support systems. Help establish strong support systems with community resources and respite care. Social workers are great team members to talk to about these needs. Regular assessments. Conduct regular interviews with older adults, look at their physical and mental health, and their living situation. Here's a small knowledge check for you. What are some signs of emotional psychosocial abuse in older adults? Drop your answers in the comments below. My answers would be sudden behavioral changes, depression, or withdrawal. Great job! Here are the materials we used to make this review. Thanks for tuning in, everyone. I hope you found this video helpful and that you'll feel prepared to recognize and prevent elder mistreatment. Stay connected with us on our social media for updates and for more content reviews. See you next time.